Hey everyone, welcome back to the Dr. Taj Show. I'm your host for today's episode, Casey Callanan, joined alongside Dr. Taj himself. Tell us about who you are real quick before I dive into today's discussion.
Well, welcome here, Casey, and thank you for our audience for joining. How are you?
I'm doing great. I'm super honored to be here, and we're going to have a really important conversation today on men's health, and we're going to talk about penile prosthesis. And when we hear that word as patients, I am not a MD, I am not a doctor, I'm not a healthcare provider. That's why we have the expert here. But when I hear that word as a non-expert, I guess I'm just a little confused. What is penile prosthesis? Is this an implant? Is this for something else? Tell us about that first and foremost.
Well, for men who suffer from erectile dysfunction and they cannot get a strong erection or they cannot maintain a strong erections, and let's say oral medications don't work, penile prosthesis or a three-piece penile prosthesis or a penile implant is an option for helping you obtain an excellent, strong erection. It's a surgical placement of a silicone type of device that inflates with saline. It's a hydraulic system, and it's surgically placed in about 45 minutes to an hour, and 3 weeks later, you don't have erectile dysfunction.
That makes a lot of sense. But there's probably a lot of different places you can go to get this penile prosthesis done. Dr. Taj headquarters, as I'll call it, is here in Northern Virginia in the DC, Baltimore area. Why do people come to you from all over the world? What's the Dr. Taj difference, as I'll call it?
Well, I have been blessed with successful results. I'm also a cosmetic surgeon and a penis enlargement surgeon. I think that makes a difference in men who want to maximize their length and girth, and the techniques that I use to push the envelope as best as I can without causing any injuries or damage is to improve their length. Multiple studies have shown that patients do better. They have less risk of complications, risk of bleeding, infection in high volume centers. There are many phenomenal surgeons in the world that perform penile prosthesis, and I'm blessed to be able to perform them on a high volume basis.
Yeah, it makes a lot of sense. I know you have, patients all over the world. So, tell us about a day in the life of someone that comes to you, just says, hey, Dr. Taj, I heard about you. I heard about this, something that you do and you're really good at it. Where do you go from there? And then what is that whole life cycle like when they first come to meet you? And then, what happens if they're interested? Talk us through that whole process.
Well, erectile dysfunction unfortunately hits men from many ages, even young men who have developed problems getting or keeping an erection. Remember, a penis is almost like a tire. It has to fill with blood, and sometimes men cannot get adequate blood flow into the penis due to either injuries or medical conditions, high blood pressure, diabetes, nerve injuries due to surgeries or neurological conditions, or patients who have inborn problems with maintaining erections called veno-occlusive dysfunction.
Okay.
So I see them, I obtain an excellent history, their review of their medications, their past medical history, past surgical history. I review their laboratory studies, and I ask them, have you done anything? Have you had any, tried any medications out there? And if they have failed medical therapies, I obtain a penile duplex ultrasound, which is a study that takes about 10-15 minutes. I provoke an erection in the office with an injection, and I study their penis with ultrasound, with duplex, study the blood flow, and see what's going on. There is no divine intervention. If you can't get an adequate erection, you need to be evaluated by a sexual medicine expert. So I evaluate them, and I sit down with them and say, listen, what do you want? Do you want to be able to make love to your wife, or how important this is for you? And I try to explain to them that penile prosthesis is not a fearful procedure. It's a 45-minute procedure through a 1-inch incision where if properly performed by an expert, you will be going home same day. You will be coming back in 3 days. I'll remove a drain, and then 3 weeks later, vast majority of my patients are able to make love to their wife like they're in their 20s.
And another thing I know that's important when you talk about any type of surgery is the number of surgeries that surgeon has done. Is that another reason why, you encourage anyone listening to kind of do their due diligence and just ask maybe how many surgeries has this, person done? And because you've done so many, is that why a lot of people come to you?
I'm a member of Sexual Medicine Society of North America and American Society of Prosthetic Urologists, where we learn the latest techniques, the latest of every technique that is done. We learn it. Yeah. And one of the benefits in me is I'm a very innovative surgeon. I'd always try to minimize tissue trauma. Yeah. And also people come from all over the world to me for penis enlargement. So I can always use maneuvers to maximize the length and girth.
Yeah, we're talking about the Dr. Taj difference, as I'm calling it, on today's episode of the Dr. Taj Show, and just trying to get to the bottom of why so many people have been coming to you over the years. For people that are interested in finding you, where's your office located? How can they kind of get in touch?
Well, we're located in Northern Virginia, in a suburb of Washington, D.C. We're close to 3 major international airports. We're 10 minutes from Dulles International Airport. Many of my patients are coming from around the globe. We had 2 patients from Canada last week, and we've had patients coming as far as Australia. We're close to Ronald Reagan Airport and also Baltimore. I think it is important for you to ask questions from your surgeon of how many they do, how many surgeries they do, and what is their success rate.
That's great stuff. Dr. Taj, I'll give you the final word. Anything else you want to say before we wrap up today's edition?
One of the key things that I hear from many of my patients after penile prosthesis, their number one regret is why I waited so many years to get a penile prosthesis.
Makes perfect sense. All right, everyone, thanks for tuning in to today's edition of the Dr. Taj Show. Dr. Taj, as always, thank you.
Fantastic. Thank you so much.